The title of my talk tonight is How to Talk to Your Doctor About Your Death. But really, like Norma, I'm really here to talk about life and how you can have a better, longer, and more fulfilled life if you take some time to plan for and talk about your death. I know that doing so is a difficult thing to do. I myself am going to be the lady on your left. And the truth is that 80% of Americans, a survey was done a few years ago, and 80% of Americans said that they wanted to live a full life and then die at home. And the fact is, when that survey was done, 70% of people were dying in hospitals and nursing homes and rehabilitation facilities. Think about that. That number's gotten better in recent years. More people are able to die at home. But Dartmouth just did a study this year and found that 30% of Americans are still spending a week or more in the ICU in the month before they die. That's a very large number. In this country, we medicalize death. In India, they put people on a funeral pyre and push them out into the Ganges. And in this country, we load you up with tubes and electrodes. We give you medicine so you can't really speak to your family. And we send you off in a haze of blue lights and beeping machines. And I'm an emergency physician by training, and I spent 14 years saving lives of anyone who walked in the door. And I really loved what I did. And I still remember some of my best saves. But over the course of that 14 years, I started to see that the more and more people who were coming into the ER were older and frailer and had multiple medical conditions. And I knew that even though I might save their life today, that the bigger picture was still not good. And I began to feel like I was doing a little more harm than good. And I knew that the reasons that I was doing so were sort of systemic, that our medical system is developed to use science to make money doing procedures, and that lawyers, until recently, but still more often than not, sue doctors for doing not enough and never for doing too much. But then I had this experience in the ER that really changed my life, I should say, and saved my life in some other ways. And this is a depiction of the family. It's not really them, but I'll call them the Liu family. And Mrs. Liu had died of cancer a couple of years before I met them after an extended battle with cancer. And she had been in the ICU multiple times. And Mr. Liu said to his adult children, "You know, that is not what I want. Please don't let that happen to me." And so ironically, a year after she died, he had a big stroke and was left unable to talk or understand language. So his adult children were caring for him and brought him to the ER many times for pneumonias because he had difficulty swallowing. And every time they told us, "Do not put him in the ICU. He does not want to be on a ventilator. Please, just do what you can to make him better for as long as possible. But we want him to be comfortable more than anything." And then one day I was working in the resuscitation part of the emergency room, and the ambulance came rushing in with a stretcher and a very frail little man on the stretcher who looked very close to death. And I recognized Mr. Liu. I went out to the waiting room and found his son and grabbed him and said, "The medics have just brought your father in and the ICU team has been called. Have your wishes changed?" And he said, "No, Dr. Brokaw, they haven't. But my sister just went away on business in China and I can't let my father die without saying goodbye to her." So I grabbed the son and I brought him back to where his father was and I said, "Call your sister right now on her cell phone." And he did. And she answered the phone from 12,000 miles away, and the signal was clear. So we put the phone up to her father's ear, and this man who was barely breathing and was blue lit up when he heard his daughter's voice. He opened his eyes. His color even improved. And they had this conversation that none of us understood because it was in Cantonese. But pretty soon a tear was rolling down Mr. Liu's face. When the phone was handed back to me, his daughter said, "Doctor, I'm on my way back to the airport and I'm gonna try and get back there as soon as I can, but I've said goodbye to my father and I really just want him to be comfortable, so please do not let the ICU team put him on a breathing machine." So I sent everybody out of the room and I told the nurses that I worked with to get him a warm blanket, some oxygen, and to dim the lights. And then I took the nurses outside with me and we left him alone with his son to have a few final moments. When we got outside the resuscitation room, I was crying and all of the nurses were crying. And we looked at each other and said, "Why haven't we done this before? Why haven't we been able to do this?" And it was that day that I decided I would hang up my own shingle and start a practice helping more patients and families have an experience like the Liu's rather than the traumatic experience of a medical resuscitation when it is futile, it won't work. So over the course of the last 6 years, I've seen a lot of these, the living will. And I would guess that many of you in the audience, this is a pretty young audience, but many of you have completed a living will because that's the way we do it in America. We go to our attorney and we settle our affairs, and at the end of discussing where our money will go and who will inherit grandma's tea service, the attorney hands you a document and says, "Well, we should really think about these things too." And it's usually very uncomfortable for attorneys. And they hand you this pro forma document that has a lot of very vague terms like terminal and vegetable and incurable, and have you sign at the bottom of it or initial at some parts. And then they stick it in the folder with the rest of your financial planning. And then you go home and stick it in a file cabinet and say, "Phew, took care of that." And that's where it sits. And I can tell you that in my years as a doctor, I have never seen a living will on a medical chart. Never. And I've never seen a doctor looking at a living will to figure out what the patient would have wanted. So I'd like to propose a different way of thinking of things. And here's my 3-step plan to creating what I like to call a quality life plan. And I think a quality life plan starts when you're very young. And the first step is to name your agent, your healthcare agent, also known as your surrogate or your durable power of attorney for healthcare. And this is the person that will legally be designated by you to make decisions for you if something should happen to you and you can't speak for yourself in a medical setting. Now, for people over age 65, the Journal of the American Medical Association published a study just last March, not even a year ago, that showed that 50% of folks over 65 needed some decisions made for them by someone else within 48 hours of getting admitted to the hospital. So right away, some decisions needed to be made and they needed help from their surrogate. And a quarter of them needed all of their decisions made by somebody else. Think about that. That's pretty astonishing. So it's really not a matter of if your healthcare agent is going to act for you at some point, it's a matter of when. And for the younger people in the audience, I'd like to say that if you're into road biking or snow skiing or football playing, that head injury is a very real risk to you. And being in a coma is something that could happen. So everyone should name a healthcare agent. It doesn't require a lawyer to have a legal healthcare agent. It just requires 2 signatures from someone outside your family and not a medical professional who is treating you. and you can download your state-specific form on the internet, no problem. Okay? So once you name your agent, then you have to communicate to your agent what the goals for your life are. What do you want to be able to do until the day you die? And in my experience, for most people, that is to be able to meaningfully communicate with people. But I've also had people tell me they want to maintain some independence and mobility, or the ability to feed themselves or dress themselves. I've had people be more aspirational and say, one guy told me he wanted to be able to do the New York Times crossword puzzle until the day he died. But goals change as we age and things happen. I had one favorite client who told me she wanted to be able to hike in the Sierras until the day she died, and then she had a really big stroke and landed herself in a wheelchair. And about 3 months after her stroke, she called me and said, I want to revise my goals statement because I know that I'm not going to hike again and my life is still worth living. And she revised it to be more along the lines of communicating and being present mentally. So goals can change. But the third thing that I want you to do is infuse your conversation with your agent, your physicians, your friends and family with your values. And I don't think values change very much over time. And by values, I mean, what's your philosophy of life? Do you have a religion or religious beliefs that are important to you? What's your feeling about money and how it should be spent? What's your feeling about what happens to the body after death or what should happen to it? Or whether you feel that being an organ donor is an important thing. And I can tell you that the values that you express will most certainly be invaluable to your healthcare agent at some point in your life. Because the truth is, modern medicine is miraculous. And it's getting more miraculous by the day. Just since I graduated from medical school, we've cloned the human genome, and there's this whole new field of genomics. Stem cells, we're figuring out how to use them, and they really promise to be miraculous as well. Nanotechnologies have created devices that will keep us alive forever. But at the end of the day, I think this slide really sums it up. What does being alive mean to you? Because certainly we will be able to extend life a lot. And you know, it's talked about that we're all going to live to over 100. But how do you want to live? At what cost to your family, both emotionally and financially? And so I think it's really important to realize that everything in life is a trade-off. And medicine will always be financially incentivized and incentivized in other ways to offer you more. And at some point, you're going to have to ask yourself 3 questions. And these are the questions I think you have to ask your medical team too. What are the benefits of this pill or this procedure or this surgery to me and my values and my goals? What are the risks? What risks am I taking here? Again, in light of my goals and my values. And are there any alternatives to what you're proposing here that might be more in sync with my goals and my values? Because although I believe that the vast majority of physicians went into the field for the right reasons and are beneficent, you know, what your physician's goals are at any given time really may be different than your own. And you've got to make sure, you've got to give your physicians the opportunity to get on the same page with you. And the reason I bring this up is because there's really been an avalanche of research in the past few years that has suggested that patients with advanced disease, such as cancer or heart failure, who take less aggressive approaches to medical care at the end of life because they've had these discussions are living longer than people who go full board with whatever's offered to them. And there are at least 3 studies that I could cite, but I won't, that show this. And I don't think the public knows that. And I think it's a really, really important thing for everyone to understand. Because in this country, we still have between 200 and 400,000 people a year dying of healthcare-related complications. So the idea of a trade-off really needs to be kept in mind. I also think it's really important for you to know that research has shown that the families of people who have died and have undertaken this process of advanced care planning, quality of life planning, whatever you call it, people who have talked about how they want to die, leave a much healthier family than those who have not. They're less likely to have prolonged grief, clinical depression, drug and alcohol use, or to sue their physicians or hospitals. So if you can't think about having this conversation for yourself, and I hope I've presented enough reasons for you to do so, think about doing it for your family. You'll leave them in much better shape. And finally, this is the picture I started off with, and I bet you assumed it was a sunset because this is the death panel, but it's actually a sunrise over the San Francisco Bay. And I think that this process needs to start when we come of age. So leading a healthy life starting at 18 means don't eat processed food, exercise 30 minutes a day, and start your quality of life plan to live the best life you can. Thanks.